I'm Russell Haythorne in Denver. Things have changed quickly over the last 24 hours with the governor moving the state from level red back to level orange. There's been some confusion about what that means for all of our great restaurants as well as other businesses and what it means for vaccine distribution, especially for those in the elderly population. So we went straight to the source and asked the governor himself about all of this. Take a look. Are you and the CDPHE on the same page on this?
Yeah, we are. What was happening, Russell, is essentially some of the counties were in orange. So it's kind of like a regional call where it just doesn't make sense that very slight differences in levels and you have people traveling deliberately between counties to go to restaurants in other counties. So we try to move as we can as a region where we really meet the criteria. So a lot of the Denver metro region, Colorado Springs metro region kind of went into red more or less in tandem. So while some counties are technically ready to come out and some aren't, it makes sense for cohesion to be together, or else you're just going to have more people traveling between the counties and potentially even infecting areas that might have lower infection rates today.
So how quickly to level orange? I mean, will that happen next week?
Yeah, they need everybody needs time to get ready. I mean, in the case of restaurants, ordering additional food and hiring people back. I think the go-ahead will likely be for early next week, Monday, Tuesday. Probably a lot of restaurants, Monday and Tuesday aren't big restaurant days. Some might not open until Thursday, Friday, Saturday. Others are telling us they're going to stay closed for indoor dining through January. That's a fine decision too if they don't have the business. We got to support our local businesses. I mean, takeout, delivery. We're nearing the end of this. Most important thing, don't party here on New Year's, right? Stay in your household, be home, pop a champagne if you want, but don't associate with people in other households. Very high viral presence right now in our state.
You've been a big advocate for school children being in school. Is part of this decision, I mean, we're moving in the right direction. Are they going back? Would you advocate for that? Are you telling districts, hey, it's safe?
Yeah, school is reasonably safe. Why? It's a very well-regulated activity, and we have what we call layered protections for the districts that are doing it well, and some have been back. Symptom checks in the morning, masks for teachers and students, social distancing where they can. If there's a window in the classroom, window open. We've, of course, like in every part of our society, there's been outbreaks, like we saw In-N-Out Burger, 180 cases. But so far, knock on wood, the methods have proven to be successful in schools because every outbreak we've had have been 2 or 3 kids or people. None of them have been 150 or 80 or 90. So it's really contained it well with the cohorting and these other measures. But for most of us, I think when you look at the risk and the benefit, it generally tends in favor of in-person education.
Last question, I promise. On the vaccines, some counties like Summit County are saying that they have a surplus now and they're offering it to the general public. How does the 70-year-old grandma sign up if that's indeed the case in some counties? And why do some counties have a surplus and others don't?
So first of all, not to the general public, to age 70 and up, to be clear. So
sorry. Yes.
For younger folks, it'll be a few more months. 70 and up, the reason the focus is on people that age, my parents' age, probably your parents' age, is that people over 70 represent 78% of the fatalities in our state. So yeah, some counties with their hospital system, which is the first group, is the people that work in the COVID wards, the nurses, the doctors, the orderlies. So Summit got through those a little bit quicker. Some other counties have. I know UC Health is already doing some for age 70 and up. But we expect everybody 70 and up. I know nobody wants to be patient. We all want this right now, right? You will be contacted when your provider, when there's an opportunity to set up an appointment. I've heard from many of my friends over 70, they got one January 8th or January 6th. But look, if you're over 70, you'll be able to get this within 4 to 5 weeks. We'll get through the whole group in 4 to 5 weeks. So I know it's tough to be patient, and even days matter because you want to hang out with your grandkids, your family, you want to go out. And that doesn't happen until, a month after you get the vaccine, right? But we'll get through the entire group of 70 up in 4 to 5 weeks, and then we'll be able to move on to other folks.
Advice on how they sign up? I mean, do they contact their local health department? Just contact your doctor?
Yeah, I mean, your doctor, if it's an independent practice, they don't have the vaccine at this point. At later dates, it'll be through pharmacies and the way we get normal vaccines. At this point, it's mostly hospitals, community health clinics, county health departments. But, again, you'll hear about it in your area. It'll be a lot easier in a couple weeks than it is now. Now it's kind of, it's almost pilot phase. We've probably inoculated just a couple % of people over 70. but it'll start getting much more substantial in the coming weeks, and there'll be community-specific plans about doing that. And remember, we're still somewhat in that phase 1A. So in many communities, they're still in the process of getting all their medical personnel that work around COVID patients inoculated. Once that's done, I think most of the states, some of the states completed that already. The whole state will be out of that sometime next week.
So restaurants like Mizuna here on 7th will be allowed to reopen this coming Monday. We talked to the guys inside Mizuna. They say they are thrilled about this new order, and they are ready to welcome customers back to in-person dining on Monday. I'm Russell Haythorne. Back to you.